first of all, the primary thing, because I was during my in my practice, I've referred several patients to Dr. Winslow that have had cardiovascular condition. The result is always great, and that was the first thing that came to mind. Okay, to go to a series of intravenous oxygen therapy, and also to try to determine the underlying cause of my condition. In addition to oxygen therapy, one thing that I've done for myself is to balance my hormone out, because I found that my adrenal gland, my thyroid gland were not functioning properly. My hormones were totally unbalanced. And so rather do some drastic measure, okay, through medication and so on, which would not have fixed my condition, because doctor told me that even with medications, I probably will live 6 months to a year maximum. And of course, I get full credit to the oxygenated intravenous oxygen therapy that today that I'm still alive. And I think that actually saved my life.
All right, sorry about that. So you're in the hospital being diagnosed.
Yeah, after they perform a series of tests in the hospital, and the doctor walks into my room in the hospital, and in disbelief, and he told me that he had no idea that my condition was so severe. And he told me that my heart was severely enlarged, number one, and number two, that I was suffering with severe cardiomyopathy, which means that inflammation of the heart muscles, and also I had bicuspid and tricuspid regurgitation. What that means that the non-oxygen in the blood, the oxygen in the blood was mixing up together. So therefore, my heart was working real hard to pump the blood and the nutrient to my body. And as a matter of fact, he couldn't believe why I was even able to work in the hospital. He said, you should have been dead by now, because my heart was only functioning, my ejection fraction is only 15%. Ejection fraction is the volume of blood that your heart is able to pump from the left ventricle to pump the blood to the rest of your body. And in my case, the normal value for a normal individual, 15%, which means that I was a walking dead. And of course, I was in shock when the doctor walks into my hospital room, told me the severity of my condition. Then I asked him, okay, doc, so where do we go from here? He said, well, three things that's going to happen. Number one, you're not going to walk out of here before we put you on the heart transplant list. Number two, you're not going to walk out of here without a defibrillator. Number three, we're going to do a stress test on you. Then it's going to have to be a chemically induced stress test, because we are not going to take a chance put you on the treadmill, because you may die on the treadmill. Of course, that was very shocking to me. So before the doctor walks out of the room, and I asked him, okay, what else? He said, that's all. I said, no, doc, before you walk out of here, let me tell you three things that's not going to happen. Number one, you're not going to put me on heart transplant list. Number two, I'm going to walk out of here, but I'm going to walk out of
After receiving a series of intravenous oxygenated nutritional therapy, coupled with other alternative holistic treatments, including diet, exercise, and hormonal-bound supplements, Dr. Francois' cardiovascular condition gradually improved and has experienced a total reversal of all previously diagnosed cardiovascular conditions. Comprehensive cardiovascular examination, including echocardiogram, performed on October 2011 at the renowned Legacy Heart Center in Plano, Texas, revealed the following: hypertension, essential; congestive heart failure, resolved; cardiomyopathy, resolved with normal ejection fraction. Estimated ejection fraction is 55 to 60%.